Good evening. I am Dr. Hamilton. I am a proud student at the Mind in the supervisory management, and this is my skills demonstration. Thank you for volunteering,
Yes.
Dr. R.
Right.
We'll keep you as anonymous as possible, but we are very grateful.
Okay. Grateful to be here.
So today we're going to be talking about sutures, and you know how wonderful suturing can be.
Alright.
And you have had the opportunity to suture before?
Yes, I have.
Very good.
I have indeed had the opportunity to suture with my line of work.
Okay. All right, sit back and relax. This is one of the no pressure suturing
Okay.
demonstrations, and it's something I speak passionately about.
Okay.
Okay, and it can make a great difference in lives. Okay, so tell me, what are the different types of sutures you're aware of, and so forth?
Oh, so the types of sutures I'm aware of are monofilament versus polyfilament.
Yes.
I know about absorbable versus non-absorbable
Yes.
sutures.
Yes.
I know about natural
Yes.
versus synthetic
Very
sutures.
good.
Yeah.
Very good. Very good. So today, in today's session, at the end of today, the objectives, I have three main objectives.
Okay.
I would like you to perform continuous sutures, okay, with a needle and needle holder,
Okay.
okay, at a rate of at least three stitches per minute for 1 minute.
Okay.
Also at the end, I'd like for you to recite the classification of sutures and give one example in each type in 1 minute with your eyes closed.
Okay.
Okay. You should also be able to express how you feel after performing the stitches yourself in 3 words.
Okay.
Got it?
Got it.
Very good. Okay. So now what we have here today, you have a pair of surgical gloves, do you?
Yes, I
Oh,
have.
excellent. Very good. So we have a silk suture, a vicryl suture.
Alright.
This is an example of polyfilamentous and absorbable suture, meaning it will dissolve in the tissue itself.
Okay.
It's an example of mersilk. It is a non-absorbable suture, and it is natural. It comes from the silkworm.
Okay.
This is the proline suture, or polypropylene. It is a synthetic suture, and it is a monofilamentous suture.
Okay.
Polypropylene used very often to close wounds because it gives good tensile strength. However, it has a good memory, meaning it has a tendency to assume the packaging configuration of being curled up. So when the surgeon is using it, it tends to curl up.
Okay.
So for that reason, it is difficult to handle, but it passes through tissue easily. Okay, and it gives it has good tensile strength, but because of its tendency to curl, it has poor memory. It has good memory and therefore poor knot security. So therefore, we usually make 5 to 8 throws for a secure knot.
Okay.
With the polypropylene. Here we have a monocryl, which is a monofilamentous suture, which you described.
Okay.
Okay, and here we have, this is a different brand of polypropylene. Okay, so today we'll be using the tissue forceps. Okay, and this is the needle holder.
Okay.
And this is a scissors to cut.
Okay.
So let's start with the polypropylene. For demonstration purposes, we can put. Can you see clearly?
Yes.
Comfortable?
Yes, I'm comfortable.
Very good.
Yeah.
So they're the appropriate height.
Yes.
So what we do, how we load the needle, we load at the tip of the needle holder, and it can be loaded in a half-half configuration where the needle holder is in the midway of the needle, or it can be 1/3, 2/3 where the needle, where closer towards the suture, it is 1/3, and toward the tip is 2/3 in front of the needle. Okay, and then today we will be suturing our makeshift wound, which are incisions or cuts that I've made in a urinary catheter, so that we can suture these and remove them and go again. Okay. Please remember, at any stage in the demonstration, anything you don't understand, please feel free to let me know. We'll clarify it and we will ensure that you understand very well by the end of today's session.
Noted.
Right, so I will show you the interrupted suturing technique. The tissue forceps and hold the tissue, enter the tissue 90 degrees and roll the wrist, okay? And roll the wrist. Then you can switch way, hold the tissue, pick it up on the other side, opposite side. Then you can pull it through. Then to make a knot, we make what we call the surgeon knot. So 1, 2 throws. Pick up the short arm of the loop, pull the opposite direction. Then you can pull the knot. I would need you to hold here for me. You can pull the knot on the opposite side. Pull the knot over one side so that it is not over the incision. Then make a loop backwards. Make a knot forward. Again, pull the knot away from the wound. Make a loop forward so that the knot is nice and flat. And with Proline, because it has good memory, we make a minimum of 5 to 8 throws and cut that 1 centimeter from the continuous suture, where after I make the first knot, surgeon's knot again, 1, 2, then we do not cut after each knot. What I do this time is we make that to 90 degrees, rotate the wrist, pick up the suture on the opposite side, 1/3, 2/3, or half. And then I rotate again, opposite side. I rotate, and again through, and then make a knot. Leave a loop, then make a knot. Yes?
Yes.
Any questions with the interrupted sutures or the continuous suture?
No.
Okay. Very well. Then I cut the knot 1 centimeter from there. So, Dr. R, I would like you to demonstrate for me that you understand. Can you perform the interrupted suture for me?
Right, the interrupted.
Yeah.
Alright, so first, I hold the needle at half and half. That's my preferred technique.
Okay.
I'll hold the tissue with the tissue forceps. Yeah. I'll enter at 90 degrees. 90 degrees. I'll go straight across. I'll rotate the wrist.
Very good.
As well. Like this.
Very good.
And I'll bring up back the suture. And I'll bring up back this.
Yes.
Suture and that.
Make a knot. That's all right. You're doing very well. You're doing very well.
Yeah. I will now make a knot.
Would you like to pull this one a little bit? Yes. Very good.
Good. Thank you. I'll first do the surgeon knot.
How many throws? Yes, very
2
good.
throws.
2 throws, I heard you.
Then put the cross.
Excellent.
Okay.
Can you just pull this through a little bit?
Yes,
If you don't mind.
Yes.
Excellent. That's
Right.
a good job. I notice your knot is not on the incision. That's very good.
Right.
You have done this before.
1 or 2 times.
Yeah, this looks more than 1 or 2.
Put it across.
Very good. That's good.
Put it across.
Excellent.
Right. And I'll
And how would you like me to cut the suture?
Cut it 1 centimeter
From the knot.
from the knot.
Oh, very good, sir. That's brilliant.
Right.
Okay.
Thank you for that. And now, do you want me to do another?
Sure, you can do another, sir. It's so nice you have to do it twice.
You have to do it twice.
Very good.
Okay. So, half and half.
Very good.
Is it 90 degrees?
Yes.
I rotate the wrist
Very good.
to this. Right, sure.
Excellent. And now I see you're holding the tissue with your tissue forceps.
Yes.
You know, one of the common mistakes is for us to hold it with, hold the needle with the tissue forceps.
Okay.
So you're doing very well.
All right. Roll it through.
Very good.
All right.
Okay. Let's give that a quick knot for us.
All right.
Yes.
All right.
That's a surgeon's knot.
Surgeon's knot.
Excellent.
Then.
Excellent. Always remember to take the knot off the wound.
Off the wound, right?
Very good, Dr. R.
Then.
Very good.
Right.
So unlike the Proline, for this Vicryl that you're using,
Okay.
you can use 3 throws, which is very good.
Okay.
I will cut. So that would end your continuous. So we will
Right.
use this for, that would end the interrupted.
Right?
You just continue with that for the continuous
continuous.
stitch form.
Okay.
In the interest of time, you'll just use the same
So.
initial stitch for efficiency.
Okay.
You're doing very well, by the way.
Okay, thanks.
Use the instrument in your hand. Excellent. So, 90 degrees.
90 degrees, roll the wrist.
Very good.
Okay.
And then we can cut that. How do you want me to cut it? 1 inch?
1 centimeter.
Ah, very good. Excellent. Brilliant. So this is Dr. R's suturing, interrupted and continuous suturing. It's very good. All right, Dr. R, that was very well done. I'm just gonna, I'm just going to ask you, how did it make you? How did it make you feel when you did your suturing? Can you tell me in 3 words?
It made me feel excited, important, and accomplished.
Very good. And can you recite the classification of sutures and give an example of each type in less than 1 minute with your eyes closed?
Oh, yes, sure. So we have natural versus natural sutures, which is things like silk, synthetic such as Proline. We have monofilament sutures such as monocryl. We have polyfilament sutures such as Vicryl. We have non-absorbable sutures such as Proline, and we have absorbable sutures such as Vicryl.
Excellent. Now, I would like for you to suture this wound at a rate of 3 throws, 3 stitches per minute, using the tissue forceps and needle holder. I'm starting the timer. Oh. Take your time, bitch. Very good. Will it pull on? It has to be nice and flat before you make the final throw, because once you make that final throw, you won't be able to secure it any better.
Okay.
Yeah. And then you go. Excellent, sir. Excellent, sir. And how would you like me to cut it for you now?
1 centimeter
Above the knot.
Above the knot.
Very good. This afternoon we had a 15-minute demonstration session with my volunteer, Dr. R. Thank you very much, sir.
Yeah.
And what we demonstrated was sutures and suturing technique. And we went through different types of sutures and classification, as well as we look at the interrupted and continuous stitches and principles and techniques for suturing. I want to thank you again, Dr. R, for volunteering, and I want to thank the MIND team for this very important skill in teaching us how to actually teach people. Thank you very much.